Good afternoon or good morning, depending when you're able to watch this webinar. I do appreciate you viewing, whether it's live or taped. And yes, this is being recorded so that people can watch it other times. It's impossible to pick an ideal time that anyone who's interested in viewing is able to attend or watch a webinar. So we're recording it so those that are unable to attend are able to watch it later on at their convenience. So let's go ahead and get started. Let me go ahead and share my screen first. Okay. I will warn you, technology is not always my friend. So I try really hard. Hopefully we won't get too many glitches. And then there we go. Once I start, now that I'm sharing, if there's any questions, I'm not going to be able to see them. So please feel free to unmute yourself to ask any questions, make any comments or anything like that. If there's anything in the chat box, I'll be happy to answer it at the end. In the meantime, if you're not talking, if you don't mind, please keeping yourself on mute. It just helps with background noises. And I'm going to apologize in advance for any noises that may occur, such as dogs barking. And I think without further ado, go ahead and get started because I do appreciate your time. Okay, so this is pregnancy and positive mental health. So our basic agenda is very short and very sweet. We're going to have just a very brief introduction, and then we're going to go over some things on why do you feel the way that you do, what are pregnancy mood swings and hormonal changes, things like that. And then, of course, the joys of pregnancy. Okay, first, really quick, a very little bit about me. My name is Laura Kibby. I am a registered nurse and have been for over 35 years now. I have a clinical background in medical, orthopedics, inpatient rehab, home health, or I should say pediatric home health, hospice. I've done managed care, and I've also done some teaching. I am not an OB nurse. However, I am the mother of 4 and the grandmother of 1, and I have been a coach for my sister and for my daughter. So I've got a little bit of a background with at least children, and then of course with nursing we do learn some of the ins and outs as well. I'm also from the Northeast, so I am not a born Texan, though all 4 of my children are Texans. So that's it. Enough about me. Let's get onward. So why do you feel like this when you're pregnant? So what are those mood swings all about, those hormonal changes? What are some ups and downs of pregnancy and things like that? Oh, and also you may see me kind of glance over a little bit. I do have some little notes, so I make sure that I don't miss anything while I'm trying to give information to everyone, okay? So first of all, just some physical changes that people go through during pregnancy. Of course, we've got the first trimester, and during that, of course, your period stops, your breasts may get larger and tender, the nipples may stick out a little bit more than normal. You notice that you may be using the bathroom a little bit more frequently than you usually do. You're more tired. You may have some nausea and vomiting, that morning sickness. That's always one of the first fun things with the first trimester. Does not happen to everyone, but statistically, I'd say over 50% usually have at least a little morning sickness. You may find that you're having some problems with heartburn or indigestion that you never used to have, especially after eating, spicy foods or something like that. Things that never used to bother you, you notice a little bit of a problem from them. Okay. Constipation, that's just because of, the changes going on with your body. And then, of course, there could be some bloating, increased gas, and of course, you'll notice some weight changes. But in the first trimester, they're not usually super huge weight changes. Okay. Then we go on to the second trimester. So this is like months 4 through 6. You're going to notice that you have an increase in your appetite. with a decrease in the nausea and vomiting most of the time. That morning sickness usually starts to fade once you get into that second trimester. Cannot guarantee that it will definitely go away. But statistically speaking, usually the morning sickness usually only lasts for the first 3 to 4 months, and then it does start to decrease. You're going to notice that your abdomen or your belly starts to get bigger, and that's because of that lovely growing baby in there. Okay. You might notice that you've got some stretch marks coming. You know, your stomach is starting to feel tight, and then it's getting a little itchy. And it's stretching. Okay, so your skin stretches a little bit. It's not used to that, so you can feel some changes. Okay. Another thing you'll notice is the skin around the nipples, the areolas, may start to get a little bit darker. And this is on all skin tones. There is a change in the coloration usually. You might notice also that you might have some feet and ankle swelling. Okay. Now this sometimes is worse depending on the time of year that you're pregnant. Usually people have a little bit more difficulty with the swelling if it's summertime. And if you just think about that in general, people sometimes have a little bit more problems with feet and ankle swelling. You retain a little bit of water sometimes. In the third trimester, you definitely can feel that baby moving around. Okay. You may get some shorter breath. If you notice, I've got some pictures up here. Oops, a daisy. Okay, and this is just a little diagram that shows a little bit on how you may feel during the trimesters. Okay, so you'll notice that, so the fifth trimester is usually when you may start feeling the baby a little bit, but as you're getting onward through that pregnancy, you're going to feel the baby move even more so. And then actually when you get super big, people panic because the baby doesn't seem to move quite as much. Well, it's not that the baby's not moving around sometimes. It's just you don't have as much room in there for the baby anymore. Okay. So you may get a little short of breath as your pregnancy increases because as you can see, your tummy's getting bigger and things. So that's pushing on that diaphragm. So it's harder to catch your breath sometimes. You may even urinate even more than what you were before. The way our body is made, the uterus is on top of the bladder. So yeah, not the best design in the world when you're pregnant. Okay. You'll get some colostrum, the yellow, white, milky type leakage from your nipples. Okay. Your belly button or navel may start to stick out. This one doesn't show it very good, but a lot of people towards the end that happens. You may start to feel some contractions. Okay. That's not uncommon at all. You also may start having some questions. Okay, so let's go on to the next slide. Okay, so why are you have all these physical things going on? So why are you having problems now with some mood swings? Why are you getting so emotional? Well, you have internal and personal circumstances that go on. And one of the things that happens internally is hormonal levels change. Your estrogen and progesterone tend to increase during pregnancy, which is very common, expected. And with the increase of those hormones comes mood swings. Okay, you'll find that you're extra tearful sometimes, you're easily irritated. It usually gets a little bit better, hopefully. Not always, but will usually get a little bit better in the second trimester. Okay. And it can be seasonal. Just think about how you feel overall when you're not pregnant with the certain seasons, and just depends on too, how do you feel with, is summer your favorite season, or is fall or winter? If there's seasons that you don't like and you tend to be a little down sometimes during some of those seasons, well, it'll be a little bit more emphasized sometimes when you're pregnant. Okay. Also, there's some thought processes that can go through that will affect your emotions and your moods. Have you had a previous loss? Did you have a miscarriage before? Or did you have any problems or complications during a pregnancy before? Then this, of course, is just this is not a first-time pregnancy, okay? Is this pregnancy been from infertility treatment? Did you have some, problems getting pregnant? Nothing wrong with that whatsoever. But, sometimes people have difficulty, and so there's more concerns. Am I going to do okay with this? Because it was so difficult to get pregnant, and we had to do alternate methods and things like that. And then there's always those doubts that are in the back of anybody's mind when they're pregnant. And these questions will come through. I would say most people, even if it's not your first pregnancy, some of these questions are going to be repeaters. Okay. What if I eat or drink something wrong? Okay. This is why you make sure you go to the doctor and you attend those prenatal visits and things, and make sure you ask questions. Is there something I shouldn't eat? Is there something I shouldn't drink? Many times, people will get concerned. They'll think, oh no, I had a glass of wine, 3 weeks ago, and I was probably already 6 weeks pregnant at that time. So, oh no, did I hurt my baby? Chances are no. But let your doctor know. Be open and honest. Don't be afraid to say anything to your healthcare provider. And if you're using a nurse midwife or a certified midwife, let them know too. Okay. This is not the time to keep like secrets. Okay. You need to be open and honest. And, sometimes trying to be open and honest will cause you to be a little shift in moods and have a little extra emotion because you're concerned that you're going to say something wrong, or, that you may have done something, like I said, the glass of wine at 3 weeks pregnant, 6 weeks pregnant, not knowing you were pregnant. Okay. Can I have sex during pregnancy? These are real common questions. What is giving birth like? As a mother of 4, I can let you know that none of my 4 deliveries was the same. None of them. Okay. One was completely spontaneous of everything. One, I had I had what's called a partial placental previa, which ended up being fine afterwards. One was an induction and one ended up being a C-section. So none of mine were the same. So giving birth each time is a little bit different. Okay. And what will the new normal be? Okay. This doesn't, when you're having your first, this is definitely what will the new normal be. If it's your second or fifth or 12th, it's still what will the new normal be, because there's that extra person coming into the family, coming into your life. So there's going to be changes, and those things will cause some emotions and things sometimes. Okay. Oops, sorry. There we go. Okay, so here's where in this particular slide, you can see a little bit where the belly button's sticking out a little bit. Okay, so we want to work towards positive transitioning to motherhood. Okay, we don't want, there to be any difficulties if humanly possible. So first you have to decide, are you happy about being pregnant? Okay, and like I said, it doesn't matter if it's your first, your fifth, or your 25th. Okay, that's a little extreme. Let's hope not. But hopefully you understand what I'm saying. I will be honest with you, when I found out when I was pregnant for my 4th child, my first thing was, oh no, oops. So my 4th child, who is a delight and is 24 now, was still a surprise. So for about a split second, I wasn't happy because I thought, oh no, it's going to be really close to its brother. And, all those things go through your mind. Okay. But it only took a minute. And then hopefully you'll be excited and happy. Some positive things about thinking about with motherhood: unconditionally loved. Okay. Especially when, the child is little. Okay. We all have to think back to our teenage years. Still always loved our parents, but okay, don't worry about that. You're going to have this beautiful little baby that you're going to love and nurture and raise. It will not be perfect, because there is no such thing as perfect. Okay, it would be nice. And there's no real true textbook. We have books with information, no true textbook. Okay. You can get comforted when you're distressed. And it's an authentic relationship. And you have a friendship and a partnership. Okay. So some things to go along with that. Was this a planned pregnancy? Like I said, my fourth one was not 100% planned. Okay. It was a bit of surprise, a good surprise, but it was still a surprise. Okay. So you have to figure out where you're at with that. There's no perfect timing for a pregnancy. Okay. We're going to talk about that in just about 2 seconds when we move down. Some outside influences and circumstances, intended or planned. Just talked about that for a minute. Are you in a committed relationship? Okay. Here's a real quick little story. I have a friend who is the mother of 2, and they were both in vitro because she didn't want a relationship. She just wanted to have children and wanted to be a mom. Mothers kind of have that advantage over fathers. Okay. So she had 2 children and she's raising her daughters. She's got family and friends around to support and assist, if like anyone that would need it. But not being in a committed relationship, though, sometimes it's a little sad. You can have a committed relationship with a friend. Okay, if your main support is a parent, a friend, someone from your church or synagogue or whatnot, okay, you can get support in a relationship in multiple ways. There's no stereotypical relationship calendar anymore or structure anymore. Sorry. Financial status. Okay. There's almost no perfect financial time to have a baby, unless you happen to be the person that lived in California and won that big Powerball. Okay. But for most of us, you want to be financially stable to an extent, but it works out. Not always easy and not always perfect, but there's ways you make sure it works out. How old is everyone? Okay, how old is mom? Okay, I was only in my 20s when I had my first child, and my last 3 were born after I was 30. There's moms out there that are in their 40s. I think I even heard of, a surrogate mom was in her 60s. She carried a child for her daughter because she was not able to conceive and carry a term pregnancy. Okay. How old are siblings? Okay. In my mom's family, my mother was the oldest of 12, and she was 21 years older than her youngest sibling. Okay. So how old is everybody? Is there like big gaps in age? My number 1 and number 2 are 10 years apart. Number 2 is a blessed surprise. Okay. So you just kind of need to look at everything. We hear all the time of like all these famous people that are, especially the men, become parents for the first time when they're in their 60s or 70s. So, you need to look at that. You need to consider that as the mom. As we get a little older, pregnancy becomes a little bit riskier, especially when we're having our first. But as long as you stay within, continue those prenatal cares and keep communicating with your healthcare provider, take vitamins and exercise and things like that, you can have a completely healthy pregnancy. Okay. Another concern or influence is pre-existing conditions, both medical and mental. Okay. Medical would be things like diabetes, high blood pressure, thyroid conditions, things like that. Okay. And of course, multiple other ones, but those are like the most common medical conditions. Then as far as mental, do you have a history of ADD or ADHD? Okay. Depression, bipolar, or eating disorders. All of those, especially depression, bipolar, eating disorders, things like that, can affect you and or your pregnancy. Okay, so that's part of the reason why we're having this little conversation right here, is to make sure not only medical is intact, but that your mental health is intact too, because both are exceptionally important. Okay. Some ups and downs. Okay, you're going to have like major ups and downs throughout your pregnancy. Okay. So you got to have some coping strategies there. All right. Moments you're going to be so blissfully happy and so excited that you're pregnant. And part of that's going to be because of increase in the estrogen. Okay. So you're going to have those really good things. And this comes with those mood swings, okay, that we've talked about already. You know, try to be happy. Go with it. There you are. You're expecting a child. Okay. This is one of those miracles in life which we can sort of explain and we can figure out how it all happens, but there's still like that awe and wonder. Okay. There are going to be times that you're going to be teary and irritable. Okay. Irritability kind of comes with it. There's times you're going to feel sad. You're going to get really anxious, especially, you know, like if you start getting a little bit further down the road about that delivery and all that stuff that happens, you're going to get a little anxious. Okay. One of the most important things to do is with your partner or your significant other or whoever's in your relationship, whatever your support system is, talk to them. Let them know. Okay. If you have a significant other, it's not their fault that you're acting like this. It's not your fault. It's just what happens to us when we're expecting. Okay. It doesn't last forever, hopefully. Okay. But talk to them. Let them know about your moodiness. Keep them involved in the pregnancy. Okay. Because the more that they can understand that they need to maybe take a deep breath and think, okay, it's not me. I know that she's just going through a phase or a spot. Okay. One of the things that we had on the last slide, or I think it was actually a couple slides before, was, can I have sex? Surprisingly sexual second trimester. It's also called the honeymoon phase. Those hormonal levels get to a certain spot and you have an unset desire to be sexual. There's nothing wrong with that as long as you've talked to your doctor. Okay? Talk to your doctor or a healthcare provider about sex. Can we have intercourse? Most of the time, with a few exceptions, there's no problem with having continuing intercourse during your pregnancy. And like I said, the second trimester, that's those months 4 through 6. It's kind of a honeymoon phase. You know, go for it. Enjoy yourself as long as there's been no contraindications given to you or no reasons why the doctor says not to have sex. Okay? There are a couple things that might prevent it, but for the most part, should not be a problem. But again, talk to your healthcare provider about that. There will be times that you have some severe fatigue and maybe foggy. Okay, again, that's those hormonal levels, and that's why make sure you're talking with and communicating to your significant other. Okay, and you're going to be going through some changes in your priorities, especially if this is your first one where your priorities been work and maybe your significant other. Well, now it may change to be mommy, significant other, and work. Okay, so you get to have this new role, especially if this is your first. Okay, depression. Okay, so if you have any past history of depression, there's a risk for reoccurrence. There is a risk for reoccurrence if you have pregnancy-induced depression. If it goes untreated, it can be dangerous to mom and or baby. Okay. Some of the things that kind of don't help depression or can be triggered and started if you start to feel real down, real sad, or depressed are things like poor nutrition. You can start drinking alcohol, smoking, which the smoking we already know can contribute to premature babies, low birth weight, and the babies that have developmental problems, excuse me. Okay, so this is why we really, if you start having any signs and symptoms of depression or feeling down, you want to go ahead and bring that to your healthcare provider's attention as soon as possible, sooner rather than later. Okay, because we want you to stay happy about the fact that you're having this baby, because that way you'll take care of you and baby better. So let's look at depression for a moment. Okay, so symptoms of depression: some intense sadness or anxiety. So if you are sad or extremely anxious and it doesn't go away, and especially if you notice that it continues for more than a day or two, or it is off and on frequently over a couple of weeks, contact that healthcare provider immediately. If you have extra difficulty concentrating, it's not unusual to, kind of feel yourself wandering a little bit, thinking about being a mother, whether this is first or fifth baby. Okay. So, a little strain of the thoughts is fine. Pardon me. But if you find that you're really, really, truly having difficulty concentrating, you can't get back focused, contact your healthcare provider. If you notice a change in your sleeping patterns, where you're getting way too much or too little, and yes, there is such a thing as too much sleep. Yes, you're going to feel tired and fatigued and things, and you may need to take a nap here and there. Okay, and that's fine. But if you find that you're sleeping, 16 out of 24 hours, or you're only sleeping about 4 hours in 24 hours, and that's a change and that's not normal for you at all, reach out to your healthcare provider. If you find an unusual change in your eating habits, okay, you're going to eat a little different. You may have some weird things that you eat. The pickles with pregnancy, there's reasons that came about. People talked about it and said stuff about it, okay? Or the pickles and ice cream is because somebody actually really, when they were pregnant, that's what they craved, okay? But if you notice that you're having a hard time eating, or if you're just like gorging and eating tons and tons and tons and tons, and especially unhealthy, reach out to your healthcare provider. If you're not interested in doing things that you like to do, you used to always enjoy going for a walk with the dog and taking them for a walk. Or you like to sit down and read a book for an hour every day or every other day, or you like to watch particular movies or go out to eat. If there's things that were routine and things that you like to do and you no longer like to do it, contact your healthcare provider. If you are thinking of death, suicide, or hopelessness repeatedly, like there's no hope for this pregnancy, and you looked at your budget's going to be extra tight. Okay, becoming a parent, that happens. Okay, but if you really start feeling negative, and it happens over and over again, or if you are having thoughts of suicide or death, if you start feeling guilty or worthless, you start having any negative thoughts more than once in a 2-week period, contact your healthcare provider. Talk to someone. There are tons of options out there. Okay, maybe not tons, but there are definitely options out there. There are groups, there's one-on-one sessions, and there is absolutely positively nothing wrong with talking to someone or getting help. Like I said, we want to have a positive mental health while we're pregnant, because we're not just thinking of ourselves, we're got to think of our baby too. But if you don't take care of you, then the baby's not going to do quite as well. Okay. And there are medications, and there are safe medications you can take that will help you and not hurt your baby. Okay. So it's really important that you don't wait. In fact, it's better to say something sooner rather than later. It's better to go talk to someone and then realize, oh, this was just okay, and this was just a little phase, and I'm not really having a problem, than to wait too long and have a problem. Okay, so I definitely encourage people. There's nothing, to be ashamed of or embarrassed. I know there's those horrible taboos that our society has previously put on mental health, but definitely wash those out of your mind. Okay, mental health is exceptionally important and affects everyone. So if you notice any of these symptoms, then please talk to someone. Okay, reach out to someone, because we want to go on to the joys of pregnancy. Okay, so let's talk about some tips and some surprises that will help us maintain a really positive pregnancy and think about the positive things that go along with it. Okay, so some tips to keep happy while you're pregnant. And this is something that you can share with your significant other or your person that's helping you through all of this. Prenatal massage. Okay, so, a little touch, a little massage, because your body's going to be changing. So a little few aches and pains and stuff like that. Little massage helps. And if you happen to be nursing, okay, so this is post after the baby comes, but if you happen to be nursing and if your significant other or somebody, an older child, comes and just rubs your shoulders a little bit, helps you relax, it will help with your milk development. Okay, so just a little pointer for after the baby comes. Aromatherapy. Aromatherapy is wonderful. Please confirm with your healthcare provider that it's okay, because most of them are completely fine, those essential oils and things like that. But double check with your healthcare provider just to make sure that there's not one that they've found as negative or anything like that. Okay. Spend time with loved ones. And I'm not even just talking about your significant other. Um, Family, friends. Is there a grandparent that you haven't seen in a little while? Go talk with them. Especially like if you have a grandmother that's still around. Um, when my grandmother found out I was pregnant for my fourth child, though, I thought she was just going to flip over, because she was just like, oh my gosh, Laura, you're pregnant again. And I said, well, Grandma, I told you I always was going to have one more than what you had. Yeah, no, I was not serious about that. But they have tons of stories. If they've even had one child, obviously they've had at least one child, or you wouldn't be here either. Talk to them, share some things with them. Let them tell you about some of the things that happened back in the good old days, because some of that stuff that used to happen is probably still really good and useful now too. Meditation or mindfulness. So what I mean by that is, do like yoga or just things for yourself. Be selfish. Okay, there's going to be a little one around that's going to take up some of your extra time that you used to have. So take some time for you, relax. Parenting classes, and a couple of these things kind of run together, so I'm going to kind of put them together really quick and then we'll talk about them a little. So like the parenting classes and talking with other expecting parents. But I am a full believer in parenting classes, especially if it's your first child. Because if you get even just one tip or one pointer out of that parenting class on like a breathing technique or something to bring with you during childbirth and things like that, then that class was a success. And I also encourage it, especially if you've got big gaps in your children. Like I had 10 years between number one and number two. Things change. Okay, we've developed some really great new stuff, and we've actually gone back and learned some old stuff all over again. It never hurts. And while you're there, you can talk with other expecting parents and find out from them some, hints or pointers, or talk about their anxieties or concerns. And what you may discover and find out is you may have some similarities going on there. Okay. And you may talk to one that's already a parent. This is not their first child. And sometimes what'll happen is, you have a new significant other that's never been through the classes. Well, go through the classes with that new significant other or whoever your coach is, especially if they've never been a coach before, because they're going to get information that's going to benefit you. Okay. Exercise and healthy eating. Okay. Even being pregnant. I had a coworker one time and she was a runner and she ran up until about 2 days before she delivered. Okay. Her delivery was like a piece of cake because she was, fit and in good condition. Not that you have to be an Olympic runner or anything like that to have a positive, easy delivery and things like that. But, she maintained contact with her healthcare provider and she was a nurse as well. But she still made sure to keep in touch and they made sure everything was going well with baby. She was a healthy eater and all that good stuff. So, there's no reason if you have a particular something that you do routinely, if you're a swimmer, a runner, you go to exercise class. Now you may have to modify things just a little bit, okay, for the pregnancy. But for the most part, if it's something you've been doing that your body is used to, nothing wrong with continuing it, okay? Healthy eating, we all know that we all should eat healthy all the time, okay? Sleep. Make sure you're getting sleep. If you get a chance to take a nap, because, like it's been discussed, you will have periods of feeling tired just because you've got this lovely little thing growing inside of you. Help others. Sometimes if you just, do community outreach or, help at a senior center or something like that, especially if it's something that you enjoy, prepare yourself. Okay. There's different kinds of things we have to prepare ourselves for the baby. Okay. We need to prepare finances because, there's going to be an extra expense. Even if you nurse, there's still an extra expense because you still have to buy diapers or furniture or whatever. And that comes with preparing the home. Okay. Some people do the gender reveal things. I personally, talking about thinking about and planning for labor, I never found out what any of my children were. Part of it was because some of them were born before they used to do big gender things. And then with the other ones, though I had the opportunity and could have found out, it really was nice personally, not knowing. It helped me get through the labor better to find out what exactly had been kicking on my bladder for 9 months. Okay. And I was really surprised my daughter didn't find out either when she was pregnant for my grandson, what she was having. She just called him Gizmo because it seemed like a gremlin was growing inside her. Um, and she said it actually did help her too. I know everybody's big on gender reveals, but just a little train of thought that if either you're not successful because baby's not cooperating, and it doesn't hurt not to know. And speak to a therapist as needed. Okay, like we already talked about, if you start feeling down, you start feeling funny, you're not sure about something, speak to a healthcare provider, therapist. Reach out to them whenever you need to. Okay, now let's see. Oh, some little surprises and perks that sometimes happen. Maybe not always, but sometimes. Okay, you get to wear comfy clothes. The baggier, the better. Okay. You don't have, I know they show a lot of people in those magazines that have all these glamorous clothes and stuff on. Hey, if you're a comfy clothes person, you've got the perfect excuse right now. Okay. You get to cancel your plans sometimes, and sometimes it can be a little blessing in disguise. Okay. Because you're not feeling good, especially at first trimester. If you're having morning sickness and maybe a little afternoon sickness, then you don't want to meet up with some people. I just don't feel good right now. Okay. You get a seat. Okay. Chivalry is not completely gone out of our society. I'm happy to say this will not necessarily happen all the time. And unfortunately, some people don't really care, but some people you will find are very gracious and will allow you to have their seat on the bus or on the train or something like that if you happen to do that. Or if you're waiting in line, they'll offer you their seat. You get to figure out what matters most. What are the most important things? Things you used to think were important. Not that they're not still something you like or that are fun or things like that. You discover that you have something that other people don't always, men never get to experience because they don't have a uterus. Okay. And other women, some women don't get to experience or choose not to experience. Okay. You're carrying a life. It's a little bit of a stressor in a way, but then again, just think of it real positive. That miracle of childbirth. You get to feel the baby move. Okay, so the first few times you're not going to be sure if that's really the baby moving or not because it just kind of feels like a flutter. And then when you're almost ready to deliver, you'll kind of wish you didn't feel the baby move so much. But feeling that baby move around, empowered by the body, that kind of goes with that what matters the most. Okay, your body conceived a child. Okay, it's totally empowerment, total aha moment. Okay, improvement of some of your physical conditions. Okay, you might find that if you have problems with acne, yeah, it's not there anymore. Okay, your fingernails don't necessarily break as much, they seem a little stronger. Glowing look with lush hair, or pregnancy, yeah, glowing pregnancy look with lush hair. Sorry. Yeah, so fingernails and hair and acne goes away. I mean, there's some very positive things that, okay, it does not happen 100% of the time, but it does happen. Okay. Let's see. Also, you might also notice that you have some decreased intolerances to some food. Sometimes you'll have an increase to intolerance, meaning, things that you didn't like, you now like, and things that never used to bother you may bother you. So, I mean, there's kind of like a pro-con there. Okay. If you suffer from migraines, sometimes migraines will feel a little bit better. Hunger fest. Like I said, I think I mentioned in the second trimester, you kind of can eat a whole bunch more, right? You still want to be careful and make sure some of those choices are healthy choices. Okay, you don't want to just strictly go with candy and cookies. But you'll find that you are able to eat, and that definitely helps make you feel better. Okay, some additional ones. Body positivity. And what I mean by that, because that sounds kind of funny, is that now you'll understand, or we have a little bit better understanding on why our bodies are slightly different than men, because we have to be able to carry a child. Okay. Any body is wonderful, but when you, like I said, get pregnant and you're carrying a child, you kind of understand why there is a slight difference between men and women. Okay. Plans for the future events. You can start planning. It's like, okay, we're getting close to holiday seasons, different things, Hanukkah and Christmas and Kwanzaa and all those other wonderful holidays. And I apologize because I obviously don't know all holidays, but the holidays are coming. You'll get to plan them with a child, knowing there's a child. Okay, so the first Christmas or two or holiday or two, when the baby's, like 0 to 2 to 3, may not be quite as much fun. But actually, when they turn into toddlers, they have fun with those holidays. Planning vacations. Where's someplace you wanted to go, but you're kind of like, yeah, maybe when we have kids, we'll go to Disney or someplace like that. Okay. Seldom a dull moment. Seldom a dull moment during pregnancy or after. Okay. So your body's changing, your appetite changes, your mood changes. Okay. So there's not during those 9 months, especially after you are confirmed that you're pregnant and you realize why some of the things have been happening, it changes all the time. Okay. one of, and if not the most intimate experience in your life, carrying a child. Okay. One thing you want to kind of watch out for is belly touchers. Okay. And I'm guilty just like so many other people. And I see someone that's expecting and that beautiful baby belly, and you just want to touch because of that miracle. Tell people no. You do not have to allow them to touch your belly. You can say, excuse me, no. If someone asks and you're comfortable with it and you don't mind, and it's a family member like grandma or grandpa, now grandpas don't seem to want to ever touch granddaughters' baby bellies. But anyways, it's up to you to say yes or no. Okay. Don't feel like you have to allow anyone to ever touch your belly. Okay. You're allowed to slow down a little bit. You don't have to go 6,000 miles an hour. You can slow down and say, okay, I need a break. You go into the zoo or something, if you happen to have like another child or just a family activity, you can say, okay, time out, need to sit. You don't have any periods, at least for a few months. Okay. Sometimes, if you're lucky, you've got courteous people in the public restroom waiting line, and they let you cut in front because they know how it feels to have to use the restroom. Okay. You're the center of attention. I mean, think about it when you've been in places and someone else has walked in that's been expecting, and everybody looks at the person that's expecting. You're allowed to take a nap and nobody says anything. Oh, she needs to rest for a few minutes. Let her get one of those power naps done. Okay. And take a minute and say thank you to your mom if you're lucky enough that your mom is still around. Okay. You kind of do appreciate your mom just that wee bit more, understanding, what she may have gone through. And like I said, no two pregnancies are ever 100% the same. There's differences in all of them. Okay. But you get to tell mom thank you, that you appreciate what she did for you that you're now doing for your little one. Okay. Let's see. Oops. Now it doesn't want to work. Oh. Questions. Sorry about that. Again, pregnancy is a very up and down emotional time. Okay. But if you have concerns, or if you have questions, if you need some additional information, here is my name, my office phone number, and my email. If you happen to already be a PCHP, Parkland Community Health Plan member already, and you're a STAR member, there's the phone number. You can call customer service and we can assist or direct you. If you happen to be a CHIP, and I'm sorry, I should have put CHIP Paranate on there, there's the number to call. If you're interested in additional information or if you have questions, there's just the main Parkland Community Health Plan website number that you can get on the website number. Oh my goodness, sorry. Website. You can get our website and look around and see if there's questions that we can answer and things like that. Like I said, I am from the north, so this is Lake Ontario. I want to thank you very much for listening. Real quick, here's a slide for my resources that I use. This again will be, let me go ahead and stop sharing my screen for a moment. There we go. Like I said, this will be posted on the website. It may take a day or two to get up there. It might not be till next week or so. But feel free to watch it again. If you have any questions, please don't hesitate to let me know. I definitely thank you very much for your time this afternoon, or if you're watching this virtually or on the recorded, I appreciate that you take the time to watch it. And congratulations. Welcome to motherhood, whether for the first time or the 30th time. Okay, that's an exaggeration. Welcome to motherhood. I hope you have a wonderful pregnancy. Remember, don't forget to reach out to healthcare providers. Don't be concerned about contacting a therapist. We're all there to help. And again, congratulations and good luck. Thank you very much.